Welcome to episode 60 of the TCM Board Formula series. Today we review Gui Si Ni Tang, Chinese Angelica Decoction for Frigid Extremities. Its category is warm. The channels A. Nourish Blood. The memory hook is cold, painful hands and feet with a fine weak pulse. Reflect channel cold on a background of blood deficiency. The illustrated cover shows every ingredient in a separate tray, and the same cover returns at the end. This is TCM education, not individualized diagnosis or prescribing. Gui Si Ni Tang contains Gui AA 1/2 A 1/2, Gui Zhi AAE, Bai Shao AC trademark 1/2, XIXIN ACE 3/4, Zhi Gan Cao AC trademark CE. Per thousand, Tong Cao AE euro. Per thousand, Dazao AA pound. Its primary actions are warm the channels, disperse cold, nourish blood and unblock the vessels. Build the formula as a strategy rather than a list. Identify what the chief addresses, how the other ingredients reinforce or restrain it, and why this architecture fits the pattern better than a nearby formula. Organize the hierarchy. Chief, Gui and Gui Zhi. Deputy, Bai Shao. Assistant role, XIXIN warms, Tong Cao unblocks, Dazao and Zhi Gan Cao support the middle. Envoy role, Zhi Gan Cao harmonizes the formula. This framework links ingredient choice to mechanism, helps explain dose emphasis, and makes the formula easier to distinguish under exam pressure. The target pattern is blood deficiency with cold congealing in the channels. Look for persistently cold hands and feet, pain, numbness, or stiffness of the extremities, pale complexion with blood deficiency signs. The tongue is pale with a thin white coat. The pulse is fine, weak, and almost imperceptible. Mechanism, symptom cluster, tongue, pulse, and treatment strategy must agree. One dramatic symptom alone is not enough to justify a formula. Differentiate the closest look-alikes. Sini Tang a Euro true yang collapse with profound internal cold. Huang Qi Gui Zhi Wu Wu Tang a Euro blood Bai with numbness and Qi deficiency. Gui Sheng Zhang Yang Ro Tang a Euro blood deficiency and abdominal cold pain. First decide hot or cold, excess or deficiency, and exterior or interior. Then identify whether qi, blood, dampness, heat, food, or yang collapse is dominant. The feature that changes the treatment strategy usually decides the answer. Safety is part of formula knowledge. Verify XIXIN species and dose. Aristolochia contamination or substitution is nephrotoxic. Gui and Gui Zhi require pregnancy and anticoagulant review. Licorice has blood pressure and potassium effects. Sudden one-sided coldness, color change, severe pain, or loss of pulse needs urgent vascular evaluation. Always verify ingredient identity, processing, product quality, dose, the complete medication and supplement list, and a monitoring plan. A classical formula name is never permission to delay urgent medical evaluation. 60-second recall. Formula, Gui Si Ni Tang. Chief, Gui and Gui Zhi. Pattern, blood deficiency with cold congealing in the channels. Actions, warm the channels, disperse cold, nourish blood and unblock the vessels. One-line hook, cold, painful hands and feet with a fine weak pulse. Reflect channel cold on a background of blood deficiency. First differential, Sini Tang a Euro true yang collapse with profound internal cold. Say those points aloud before moving to the final ingredient cover. Here is the complete ingredient cover again. Name every tray from the on-screen ingredient list, then state the pattern, actions, top differential, and main safety warning. This concludes Gui Si Ni Tang. Save it for spaced repetition and connect board memory with qualified, safe clinical judgment.